Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, differentiation of hepatocellular carcinoma and differentiation between the fibrolamellar hepatocellular carcinoma and focal nodular hyperplasia. Okay, if you see both of them have a central scar. Okay, both of them have a central scar. Then if you see one more important thing, but how are you going to differentiate them? They are mainly differentiated by in fibrolamellar hepatocellular carcinoma. Calcification is present in 32 to 35% of cases of fibrolamellar hepatocellular carcinoma. And even this calcification is seen, and also heterogeneous enhancement is also seen in fibrolamellar hepatocellular carcinoma, and these are not seen in focal nodular hyperplasia.
thank you and thank you for watching.